Maintaining a nutritious diet becomes more crucial as we get older in order to promote general well-being and control long-term medical concerns, including diabetes, heart disease, and digestive issues. Because they include vital vitamins, minerals, and antioxidants, fruits are often regarded as the foundation of a balanced diet. However, not all fruits are equally healthy for seniors, and some may be quite harmful to their health. Certain fruits may be dangerous for older persons due to factors including high sugar content, acidity, or possible drug interactions, although the general public may not be concerned about these dangers. Elderly people often have particular nutritional needs, such as reduced metabolism, altered digestion, and drug dependence. Consuming the incorrect fruits may cause blood sugar levels to rise, worsen digestive problems like acid reflux, or even conflict with prescription drugs. Because of these possible health hazards, we will highlight 8 fruits in this video that seniors should be wary of or stay away from completely. Seniors and those who care for them may make better dietary choices that support lifespan and health by being aware of these specific fruits. As usual, before making any significant dietary changes, particularly while treating chronic diseases, it is advised to speak with a healthcare professional. Please take a time to like, comment, and share this material with your friends if you're enjoying it before we go on. By doing this, more people become aware of the channel. Let's now discuss the 8 fruits that elderly people should never consume. Despite being tasty and high in vitamins, pineapples are another tropical fruit that may seriously harm elderly people, especially those who have digestive disorders. Because of its high acidity, pineapple may make illnesses including heartburn, acid reflux, GERD, and gastroscopy reflux disease worse. These disorders are more frequent in older persons. For those who already have digestive issues, the strong acidity of pineapple may irritate the lining of the stomach and esophagus, causing pain and exacerbating symptoms. In addition to its acidity, pineapple has an enzyme called bromelain that may make digestive health issues worse. Although bromelain is well known for its ability to reduce inflammation, it may also irritate the stomach, particularly in elderly people who already have digestive disorders or sensitive stomachs. For some people, eating too much pineapple may cause nausea, diarrhea, and even vomiting. For elderly people who are already at risk for digestive problems, pineapple should be avoided or consumed in moderation due to the possibility of such negative effects. Pineapple is also bad for your teeth. The fruit's strong acidity, which may erode dental enamel and raise the risk of tooth decay and sensitivity, is another issue for seniors. Elderly people who may already have dental issues as a result of aging should exercise extra caution while eating acidic fruits like pineapple. Cavities, gum disease, and other dental problems that may be costly and difficult to cure can result from eroded enamel. While some of these effects may be lessened by washing the mouth with water after eating pineapple, many seniors may find it preferable to minimize or stay away from this fruit completely. Because of its simplicity and reputation as a nutritious, high-potassium diet, bananas are a staple fruit for many people, including seniors. However, certain seniors may find bananas troublesome, especially those who have renal disease or are on certain medicines. Although potassium, which is abundant in bananas, is necessary for heart and blood pressure health, too much potassium may be harmful to those with impaired kidney function. Because the kidneys are in charge of removing extra potassium from the blood, hyperkalemia may occur when potassium levels rise as a result of their malfunction. Hyperkalemia is a dangerous illness that may lead to exhaustion, muscular weakness, and in severe situations, irregular heartbeats or even heart failure. Particularly at risk are elderly patients using drugs like potassium-sparing diuretics or AC inhibitors, which are often used to treat heart disease and high blood pressure. These drugs have the potential to raise potassium levels in the body, and eating foods high in potassium, such as bananas, can make this effect worse and result in dangerously elevated blood potassium levels. In addition to the risks associated with potassium, eating too many bananas can also cause constipation. Although bananas are often regarded as a source of fiber, as they mature, their fiber content drops and they become more starchy. Overripe bananas may slow down bowel motions and cause constipation in seniors who already have digestive problems or sluggish digestion as a result of aging. Because constipation is a prevalent problem among older persons owing to a number of causes, such as medication usage and decreased physical activity, this may be very difficult for seniors. Dried fruits, such dates, apricots, and raisins, are often promoted as nutritious snacks because of their mobility and high nutritional content, but they might pose a number of difficulties for elderly people. Their excessive sugar content is one of the main issues. A concentrated supply of sugar is left behind when fruits are dried, which removes the water. This implies that for elderly people with diabetes or those who are at risk of developing insulin resistance, a tiny portion of dried fruit may have the same amount of sugar as many servings of fresh fruit. In addition to their high sugar content, eating dried fruits may result in quick blood sugar spikes that make it challenging to control blood sugar levels. Digestive problems may also result from dried fruits. Even while dried fruits are a wonderful source of fiber, the concentrated fiber in them may cause pain, gas, and bloating, particularly in older people with delicate digestive systems. Seniors who already have digestive health problems, such as those with irritable bowel syndrome, may have problems like cramps or diarrhea if they consume too many dried fruits at once. Dried fruit's thick texture might aggravate symptoms of diverticulitis or IBS and cause flare-ups. The preservatives often found in commercially available dried fruits are another factor to take into account. Sulfites are often added to dried fruits in order to prolong their shelf life and maintain their color. Although sulfites are usually thought to be harmless for most people, those who are sensitive to them may have allergic responses or symptoms of asthma. Sulfite-containing dried fruits should be avoided by seniors with asthma or other respiratory conditions since they may aggravate existing conditions. Tropical fruits like mangoes are prized for their luscious texture and sweetness. Although they are high in antioxidants and vitamins A and C, mangoes may have some serious disadvantages for elderly people. The high glycemic index of mangoes is one of the main issues. High GI meals may be especially dangerous for elderly people with diabetes or prediabetes, since they cause blood sugar levels to increase rapidly. Despite their nutritional profile, mango's high natural sugar content may result in quick blood sugar spikes, making it difficult for seniors to control their blood sugar intake and maintain stable glucose levels. Mangoes and other high GI fruits might make blood sugar fluctuations more difficult to manage due to abrupt decreases or spikes in blood glucose. This may cause feelings of exhaustion, anger, and disorientation in addition to raising the risk of diabetic consequences, including neuropathy or eyesight issues. In addition to their glycemic impact, seniors who like mangoes should consume them in moderation and maybe in combination with lower GI items to help balance out the effect on blood sugar. In comparison to other fruits, mangoes are also very high in calories. Despite their abundance of nutrients, they can cause unintended weight gain if consumed in excess, especially for elderly people who are less active. As metabolism slows down with age, it becomes more difficult to maintain a healthy weight, and foods high in calories like mangoes can make this even more difficult. Seniors who are seeking to control their weight should watch how much they consume and make sure they only eat mangoes sometimes rather than every day. Because of their rich taste and high fiber content, figs are a popular option for anybody trying to improve their digestive health. Although fiber is necessary for a healthy digestive system, the quantity of fiber in figs may potentially be harmful to seniors, particularly if they eat significant quantities of them. An example, seniors who already have weaker digestive tracts as a result of age may have digestive irritation from consuming too much fiber. Bloating, constipation, or even intestinal obstruction may result from consuming too many figs. The fiber in figs may often cause or exacerbate symptoms in older adults with diverticulitis or irritable bowel syndrome, IBS, causing discomfort or even flare-ups of their diseases. Furthermore, seniors who eat too many figs at once may experience dehydration or diarrhea due to the natural laxative action of figs. For older folks, dehydration is especially problematic since it may worsen pre-existing conditions like renal disease or cause major side effects like disorientation or urinary tract infections. The high sugar content of figs is another possible hazard. Despite their high fiber content, figs are naturally rich in sugar, which may raise blood sugar levels in elderly people with diabetes or insulin resistance. They are thus a dangerous fruit. Seniors who like figs but are attempting to control their blood sugar levels should eat them in moderation, especially if they are fresh rather than dried, to avoid the high fiber and concentrated sugars that may cause health problems. Because of their rich taste and high fiber content, figs are a popular option for anybody trying to improve their digestive health. Although fiber is necessary for a healthy digestive system, the quantity of fiber in figs may potentially be harmful to seniors, particularly if they eat significant quantities of them. An example, seniors who already have weaker digestive tracts as a result of age may have digestive irritation from consuming too much fiber. Bloating, constipation, or even intestinal obstruction may result from consuming too many figs. The fiber in figs may often cause or exacerbate symptoms in older adults with diverticulitis or irritable bowel syndrome, IBS, causing discomfort or even flare-ups of their diseases. Furthermore, seniors who eat too many figs at once may experience dehydration or diarrhea due to the natural laxative action of figs. For older folks, dehydration is especially problematic since it may worsen pre-existing conditions like renal disease or cause major side effects like disorientation or urinary tract infections. The high sugar content of figs is another possible hazard. Despite their high fiber content, figs are naturally rich in sugar, which may raise blood sugar levels in elderly people with diabetes or insulin resistance. They are thus a dangerous fruit. Seniors who like figs but are attempting to control their blood sugar levels should eat them in moderation, especially if they are fresh rather than dried, to avoid the high fiber and concentrated sugars that may cause health problems. Because of their distinct taste, lychees are a popular sweet and exotic fruit. Although lychees are abundant in vitamin C and antioxidants and are often found in tropical areas, they may pose some hazards to elderly people. One of the most worrying problems with lychees is that they might lead to blood sugar instability. According to some research, eating a lot of lychee, particularly when you're not eating anything else, can result in hypoglycemia. Seniors who have diabetes or are on blood sugar-lowering medications may have dangerously low blood sugar levels, especially if they already have issues regulating their blood sugar. Although it is uncommon, the phenomenon of hypoglycemia associated with lychee consumption has been observed in cases where large amounts are consumed. This emphasizes the need for moderation, particularly for seniors, as a sudden drop in blood sugar can cause dizziness, confusion, and fainting, all of which are dangerous for older adults and may raise their risk of falls or other accidents. Seniors who love eating them should be careful not to consume too many of them at once, and should make sure they eat them as part of a balanced meal rather than on an empty stomach. The possibility of allergic responses is another issue with lychee. While the majority of people have no trouble enjoying Lychees, some people, especially those who have a history of fruit allergies, may have responses that range from minor symptoms like rashes and itching to more serious ones like breathing difficulties. Elderly people who have a history of allergies or weakened immune systems should use lychees with care and pay attention to any strange symptoms that may arise after eating them. Pomegranates are often praised for their strong antioxidant content, especially their polyphenol, which are thought to lower inflammation and promote heart health. Seniors should be aware of the hazards associated with pomegranates, despite the fact that they have many health advantages. The relationship between pomegranates and certain drugs, especially blood thinners like warfarin, is one of the biggest worries. May alter how these drugs are metabolized, raising the possibility of severe bleeding or bruises. Seniors using anticoagulant medicine to prevent blood clots need to be very careful while eating pomegranates, since the fruit or its juice might increase the drug's negative effects, which can be deadly. Seniors should speak with their healthcare professional before including pomegranates into their daily diet, since they may also interfere with drugs for high blood pressure and cholesterol. The inability of some elderly people to eat pomegranates is another problem. Despite its nutritional value, pomegranate seeds may be challenging to chew, particularly for elderly people with dental problems or those wearing dentures. Those with sensitive teeth or gums may find the rough seeds uncomfortable or a choking danger. Pomegranate seeds' fibrous texture may also be taxing on the digestive tract, causing discomfort or constipation, especially in elderly people who already have digestive issues. Many people like cherries because they are a sweet and sour fruit, especially in the summer. However, because of their high sugar content and possible diuretic impact, cherries might be hazardous for seniors. Although cherries are a good source of antioxidants and vitamin C, their natural sugar content may be problematic for elderly people who already have diabetes or are at risk of getting it. Seniors may find it more difficult to control their blood sugar levels if they consume too many cherries, since they might cause blood glucose rises. The diuretic qualities of cherries are another problem. Because of their inherent diuretic properties, cherries may cause an increase in urine output and more frequent urination. Cherry consumption may worsen the effects of diuretic drugs, which might cause dehydration in seniors already taking them for illnesses including high blood pressure or heart failure. Because the body's capacity to retain water diminishes with age, dehydration is a major worry among older persons. Dizziness and disorientation are only two of the many issues that may arise from dehydration. Additionally, although cherries might have health advantages, including lowering inflammation and promoting heart health, seniors who love them should watch their fluid consumption and be cautious of portion sizes to prevent dehydration. Urinary tract infections are also more frequent in seniors. They are a fruit to be wary of because of the dangers of their sugar content and diuretic impact, especially for those with diabetes or those already on diuretic effect drugs. Seniors who want to manage chronic health concerns must maintain a balanced diet, maintain vitality, and promote general health. Fruits are an essential component of a healthy diet, but because of certain hazards, not all fruits are appropriate for senior citizens. The need for careful attention is highlighted by the strong acidity of pineapples, the potassium content of bananas, and the concentrated sugars in dried fruits. Even though they are often praised for their nutritious content, mangoes, figs, lychees, and pomegranates might present special dangers for seniors, including blood sugar rises, digestive problems, and medication interference. It's important that elderly people and those who care for them understand these hazards so they may make wise fruit consumption choices. Given that every person has different medical requirements and prescription schedules, speaking with healthcare professionals is essential. Seniors may maintain a healthy, balanced diet that promotes their general health without running the danger of negative consequences by knowing which fruits to avoid or eat in moderation.